I'd like to talk today about the presentation that was made at the Oxford AHSN Partnership Board on the 30th of March on two projects that have been developed in the Wealth Creation Programme. The first of these was an initiative called the Healthy Towns Programme, developed by NHS England, where Bicester has been labelled as one of 10 sites in the UK for development. And the second was a project looking at the valuation of a series of activities we've been involved with in collaboration with the Office of Health Economics and RAND Europe. In the Healthy New Towns initiative, back in August last year, a group of stakeholders from the local region came together to develop an expression of interest around Bicester and how that could contribute to a healthy programme with NHS England. At the end of September, we submitted an expression of interest, and then out of 114 applications, we were one of 16 that were invited for interview in London in February. As a result of this, in March, beginning of March, we were awarded one of the 10 sites, and we were delighted to be able to take this programme forward. The lead applicants in this were Cherwell District Council, which has taken the formal lead for the bid, the Oxfordshire CCG, the developer A2 Dominion on the Bicester site, and ourselves, the Oxford Academic Health Science Network. In addition, we have over 20 partners in this group, and we've been working on looking at how the built environment can contribute to healthy living. In particular, we've been looking at ways in which designing around the environment can help the elderly, and look at ways in which social interactions can be improved within a town environment, as well as ways in which technologies, both digital and diagnostic, could contribute to improved living. The development itself has started with 393 homes, all of which are eco-acclimatised, and this is going to increase to around 13,000 homes as the final size of the development. So this is quite a considerable project in moving forward. We're going to be working with NHS England in terms of developing in detail the scope for this programme over the next couple of years, and working with our partners to deliver what we hope will be an interesting opportunity, both for the residents of this new development and in ways in which we can take the technologies and the learnings, particularly around social care, issues around social isolation, diet and mental health, and use those to inform others on a national basis, as well as to take learnings from the other sites that we might develop ourselves. Finally, I'd just like to say thanks to all of our partners that have been so well engaged in this process, which includes the two universities, the two trusts, third sector organisations, ISIS Innovation, and a number of others. The second programme that we looked at involved a health economic analysis of 4 projects that we've been undertaking at the AHSN. The first of these was involved with the Anxiety and Depression Clinical Network, where improved access to psychological therapy was analysed. During a period of time of around a year, there was an increase in recovery of 5%, and the analysis looked at, for a 2-year period, the changes against a national average. During that period, within the Oxford region, there was an improvement of 34,000 patients that went through the process, and over 20,000 who recovered. In terms of cost savings, this amounted to over £750,000, which OHE concluded represented good value for money. The second project involved the Maternity Clinical Network, which looked at improvements to the pathway for babies, premature babies at risk. And during a 2-year period where a baseline analysis was done, a comparison was then made with the improvements to the pathway as they were referred to a level 3 centre. During this period, 4 babies actually were in improved survival. The third project was looking at carbon energy savings across a number of trusts within the Oxford and Thames Valley region. A benchmarking exercise was undertaken, and 5 trusts were identified to develop business cases in partnership with the Carbon and Energy Fund to then take those forward for a capital investment and then the delivery of savings. During this process, a total estimated investment of £23 million was calculated, which would then generate savings of around £6 million per year, with carbon savings, CO2 savings of £29,000 per year. This would represent a payback of 3.9 years, and it was concluded again that this was a good investment for money based on what was done. The final project looked at intermittent pneumatic compression stockings for the prevention of stroke, and this was part of a programme of the Clinical Innovation Adoption. During an 18-month period, an assessment was done and a rollout of the IPC was undertaken across the region. And the analysis concluded that 22 DVTs were prevented, 2 PEs were prevented and 12 deaths. And this was all at an added cost to the system of only £31,000. This represented around £72 per stocking that was used across the region, and over 400 patients actually received the stockings. It was also concluded that this represented good value for money. The AHSN believes quite strongly that using these types of approaches helps us to quantify the benefits to the system and also to the various different stakeholders, so that there is a clearer understanding of the outputs of the various programs that we have, and we will be using this on an ongoing basis on further programs.